back to the channel. So we are dealing with the forms of candidiasis. We have almost finished the candidiasis form. The first we have seen was pseudomembranous. Then we have seen the atrophic candidiasis, in which we have seen two things. That was angular cheilitis, and second was median rhomboid glossitis. Okay. Third, we have seen the hyperplastic kind of candidiasis, and in last class we have seen two types of candidiasis. That was mucocutaneous candidiasis and disseminated candidiasis. We have also studied that disseminated candidiasis can result from a mucocutaneous candidiasis, and it is not more commonly seen in maxillofacial region, or we as an oral and maxillofacial surgeon or dentist doesn't encounter with disseminated candidiasis. And about mucocutaneous we have seen that is the most serious form of candidiasis, because it has a systemic distribution and the host defense system or immune system is compromised. Now today we'll be dealing with the differential diagnosis. सबका साथ में will be dealing with, okay, all together. Let's start. Differential diagnosis. The pseudomembranous form of candidiasis will resemble the mucus patches of secondary syphilis, mucosal chemical or heat burn, and spectrum of lesion of clinical leukoplakia, that is verrucous hyperplasia, verrucous carcinoma, or squamous cell carcinoma. Okay, so the differential diagnosis of pseudomembranous will be the secondary syphilis, mucosal chemical or heat burn, because it gave that mucus patches, and the spectrum of lesion of clinical leukoplakia, mainly the verrucous hyperplasia type of leukoplakia. It can also resemble verrucous carcinoma and squamous cell carcinoma. The median rhomboid glossitis, that is a type of atrophic candidiasis, will resemble lichen planus. So the differential diagnosis will be lichen planus. Now, the atropic form, in which a pebbly velvet-like soft tissue enlargement of palate develops, suggests a non-Hodgkin's lymphoma. तो जो एट्रोपिक फॉर्म डेंचर के उसमें मिलते हैं, एंड दे आर इन द पैलेटल and they give velvet pebbly like appearance, so they also resemble the non-Hodgkin's lymphoma. And the disseminated form will appear as a bacterial septicemia, often with thrombophlebitis. और जो disseminated form है, that will appear as bacterial septicemia. Now, coming to the diagnostic workup in general for candidiasis, the tissue biopsy stained with pus stain. Pus stain से mainly करते हैं, because the pus stain tissue specimen will better outline the organism and show evidence of tissue invasion. Candida organism can be readily cultured on Seborrhoe's medium or routine blood agar plates. So, culture and biopsy are two diagnostic workup for candidiasis. Now, coming to the histopathology part. First is, okay, we are more dealing with pseudomembranous candidiasis in detail, or the every part in detail of pseudomembranous candidiasis, because it is the most commonly seen candidiasis. The thickened parakeratinized layer are separated by neutrophils by edema and infiltrated by neutrophils. Okay, the thickened parakeratinized layer is separated by edema and are infiltrated by neutrophils. Neutrophils collect as microabscesses, and there are numerous hyphae. So this is significant of candidiasis, that hyphae are present histopathologically, capable of invading the epithelial cytoplasm and exist as an intracellular parasites. तो वो जो cytoplasm उनको invade कर देते हैं और intracellular parasite जैसे act करते हैं या exist करते हैं. Underlying connective tissue contains lymphocyte, plasma cell and macrophages. Okay. Now, coming to the atrophic kind of candidiasis, histopathologically क्या अंतर होता है? The hyphae. Okay, these both are the acute form of candidiasis, and in chronic form we'll see more of macrophages and all. So I have not told about the histopathology of the chronic form. These two are the acute form, and I am dealing this two in like brief कि हाँ ऐसे ऐसे होता है histopathology में. The hyphae tend to be sparse and the inflammatory inflate in the lamina propria is denser in atrophic candidiasis. That's all for today. We'll meet in next class. Till then, like, share, subscribe and comment. Bye.